Florence Nightingale is known as the founder of modern nursing. She was born in 1820 and grew up in England. At the age of 17, she wrote that she felt called by God to devote her life to nursing, but she knew that her family did not approve of her calling. So at the age of 24, she finally made her announcement known that she was going to be a nurse for the rest of her life. She was very modern for her time. She forsook everything for her career, including being a wife and mother, which was typical of that time. She's most known for her contributions during the Crimean War. Florence and a team of 38 other nurses were sent to the Ottoman Empire to help the medical crisis there. Florence found that most of the soldiers were passing away from infections and poor hygiene associated with their wounds rather than the battle wounds themselves. She stated that she was shocked to find that many new wounded soldiers were placed on the bedclothes of those who had just passed away. This led to rampant infection amongst the soldiers in these medical units. I think one's feelings waste themselves in words. They ought all to be distilled into actions which bring results. She instituted what was considered revolutionary at the time: separation of waste from nutrition, as well as regular changing of beds and dressings. These are now typical practices today in nursing. We now know that these infections are caused by bacteria. Florence is said to have written, though, that she did not believe that germs even existed. Florence Nightingale was also crowned with the title of Lady with the Lamp, for she was seen as a beacon of hope to many soldiers during the Crimean War as she made her rounds during the night shift. Florence was a very interesting character as well. I can imagine that her ideas and insights were sometimes laughed at by the men in her career, as well as the women. Anybody who is an agent of change is sometimes met with some hostility. I attribute my success to this: I never gave or took any excuse. But Florence fought for her ideals, and she won in the end. She is known for being one of the first healthcare workers to use evidence-based practice. She proved that soldiers were passing away by poor hygiene by conducting studies and tabulating her work and presenting it to other healthcare workers. Nurses hold her up as a standard, like they did it in the past, as a lady with the lamp. She's a guiding force behind our belief in quality of care and evidence-based practice. In 1893, a training school for nurses in Detroit developed the Nightingale Pledge, which is recited at many graduation ceremonies. It is an alteration of the Hippocratic Oath for nurses, by nurses. She died in 1910 at the ripe old age of 90, and she continued to advocate for quality of care amongst her patients.
Loran!